My name is James Huhta. I'm a perinatal cardiologist, which means that I'm a cardiologist for the fetus, the child, and mother as it relates to congenital heart disease and problems of the heart. Pediatric cardiology is really my specialty training area, so I've been practicing pediatric cardiology since, I suppose, 1980 or so. And gives me an opportunity to see what's going on the fetal heart before birth, and then be involved in the transitional circulation around the time of the baby's birth, and then preparing the baby for heart surgery, and then following them long term. So you might think of it as womb to tomb cardiology. Seeing the way pediatricians took care of patients, I saw that as my calling, if you will, and was trained in Birmingham in pediatrics. And that's where I really developed a love and an affection for pediatric cardiology, the care of children with heart problems. So I had the opportunity to train at Mayo Clinic for 3 years, a year in London at Great Ormond Street Hospital for sick children, and then I went to my first job at Texas Children's Hospital. How perinatal cardiology really developed for me was seeing that connection, if you will, the mutual need between the obstetrician and the cardiologist. So I came to Tampa in 1996, and we helped to build the cardiac program here and start it here at St. Joseph's Hospital, at the Children's Hospital, which was even prior to the time it was built here, where we're sitting. And then St. Joe's Women's and Children's has always worked together to do that connection for fetal cardiology. St. Joseph's Children's is connected to a very large adult hospital with an outstanding cardiology department, and a women's hospital also, which is all under one umbrella, if you will. And if you think about it, perinatal cardiology is cardiology for the fetus, child, and mother. But also with the adult cardiology services and other advanced surgical services, where an adult with congenital heart disease who may be pregnant could be managed in a specialized fashion. Being here is always special for me because I think there's a certain friendly environment here that I find as a physician very welcoming and very kind of good for, I think it's good for patients when the doctors are happy and they do take good care of us. If you have a problem with a leaky faucet and you'd have asked a plumber to come in, if that plumber has been fixing leaky faucets for 30 years, then you know that when he leaves your house, your faucet almost certainly not going to leak. And so, having practiced pediatric cardiology for over 30 years myself, I like to think that I can share with families, calm their fears, give them information, and not always be right, but always have them know that I'm there with them in the care of their child.